name's Sue Karen and welcome to today's NSK podcast in which I speak with Alfonso Ray. Alfonso is principal of Queen's Square Dental Clinic in Bristol and originator of the Delta Academy, which offers dental courses for all professional needs and interests. Alfonso has worked with NSK for a number of years and I'm interested to learn his thoughts about dentistry in general and why he chooses NSK equipment for both his practice and the academy.
How are you?
I'm good, thank you. Are you? Happy New Year.
Nice to see you.
And you, yes. And I believe you've been expanding your practice empire, so people tell me.
Yeah, I try my best. So no, it's going well. It's like it's a slightly different challenges, but nice. And I can't complain with anyone because it's self-inflicted. So.
And how's the COVID situation? What's that doing to you?
Fairness, better than I thought in terms that, obviously with the announcement of Monday, everyone was a little bit nervous about how people were going to react. I think that this time we were a lot more prepared. And I think, we were I was involved quite a few groups about reopening back in June. So we did quite a lot of research and investment in filters, protocols, and people that were really appreciative at the time. And I think, we've kind of almost gained that credit and people, they feel safe. And
Okay.
I was expecting yesterday to get cancellation. So I think patients, they've been really understanding. And I don't think we had any cancellation at all so far.
Oh, great.
Staff they've been all really good. We've also been as accommodating as possible with childcare and changing slightly the hours, so I think that should be fine as well. So hopefully will not affect the business this time as much as it was last time.
Yeah.
The thing that I have to say is that because all my practices are fully private, the NHS, rightly or wrong, is really not doing much. So we are getting a volume of because my main one is referral practice. The number of referrals that we're getting at the moment is the highest that it's ever been.
Really? Wow. Yeah.
We don't do root canal, so they refer everything to the specialist.
Yeah.
So that is kind of.
I also think patients, as you say, practices are a very safe environment. And I think, if patients can't get it on the NHS and they really want it, then, they've all been sat at home, not able to spend money on holidays or whatever, have they? So actually, from what I'm hearing, people are thinking about their teeth, aren't they? And wanting to improve things.
Yeah, that is also the other things that I was going to mention. The amount of Invisalign or implants that we've been doing for the last couple of months has been probably the highest that we ever had.
Yeah.
And it's because I think people also, a bit what you say, that in a bit like, the rethinking about priority at the time, the things that we know that it's likely that will be at least for the next few months like this, where, there is not much you can do in terms of planning holiday or things like that.
No.
And people are focusing more investing in themselves rather than, let's say, the layers, which, from our side has been working quite well.
It's interesting, isn't it? Yeah. Just briefly, Alfonso, just so that I know, how much time have we got? Have we got
For you, I've got all the time of the world. I'm all yours.
Okay, that's cool. Brilliant. So just obviously I know a little bit about what you do in terms of the Queen Square and the Academy, but just brief summary of where you are with your practice or practices and the work that you're doing with the Delta Academy as well.
Yeah. So with the practice, basically what we've done now is we've set up as a small group. So we are a small independent or private group. Overall, we've got about 7 sites.
Okay.
So 7 practices. One of the things that I've done recently is start few partnership with plastic surgeons. So 2 of the practice we are kind of like in a medical center with the plastic surgeons, and it's something is working quite well as well.
Yeah.
And that is mainly the practice
And
side.
they all the practices are sort of in your region, basically.
No, we've just acquired the first one in Windsor. So,
Okay.
we've created this small group, is called like Apollonia Clinics, is our
Yeah.
group. And our idea is to probably buy a few more practice on the M4 corridor. So going from Cardiff toward, like Reading, London, let's say, but not
in
really London. No, not in London.
No.
We're
Yeah.
not in-
Yeah, because you bought David Winkler's practice, didn't you?
Yeah, but Dave is the last one we got. Yeah.
Yeah, that's a lovely practice, actually, isn't
Really
it?
nice practice. Yeah.
Yeah, right in the centre of Windsor. Yeah.
Yeah, it's like with the castle just in front of the branch.
Yeah. You might get royalty in there. You never know.
Yeah.
And then, in terms of the academy, where are you with that, and how how is that working, and what are you offering in terms of
In
training?
terms of the academy, since we spoke last time, now we are at the next stage. So I think I probably mentioned to you at the time that we were planning to have like a dedicated teaching center. Now we do have that. So we've got a proper academy with the benches, microscopes, surgery with the camera for the live surgeries. So there is a dedicated center, a dedicated teaching center. Because I think once I saw you last time, we were still running the course from the top floor of Queen Square in that teaching room.
Yeah.
Rather than now, thankfully we've got like a dedicated place. The courses, we've increased the number of courses, because we started mainly with the implant courses with Straumann at the time, and now we are kind of at the next stage, because with Straumann at the time, I was mainly running Straumann courses, but now we are a lot more kind of a proper academy independent. And then we've got sponsorship of companies such as Straumann, Geistlich, NSK, a lot of different companies. And we'll do a lot more other courses as well. So we've got like now, in terms of implant, we've got different level, but probably about 4 or 5 courses a year. All the course, we kept the ethos of a small group where we can interact with the delegate, really have like one-to-one. So try to make friend as well as delegates. And we also treat patients almost in every courses, or at least there is always an hands-on element if it's not possible to treat patients or live surgery. So it's always really not just the theory or classroom. And then we're doing now a lot of like endodontic courses, oral surgery, composite, photographs, rubber dams. So it's much wider as a portfolio of courses since we spoke a few years ago.
Okay, and in the main, GPs coming on those courses, so general dentists coming on those courses, or a different.
We've got like, I would say we've got like a different level of courses, because for example, my standard implant course, then usually are the GP that they've never placed an implant and they want to start to place the implant. That is probably one of the most popular courses. But for example, like Massimo does a few endo courses for like a microsurgery. So just apicectomy with the microscope. Or we've got there is this Japanese dentist that he does like he teach how to remove a broken instrument when people they do root canal. So for example, like on that course, we did that in at the King's in London, and we had the 25 dentists, few from abroad as well, because it was his first course in Europe. And I think we had like 12 specialists from UK.
Okay, wow.
So we are really getting kind of course for all different levels. So we're really starting from the nurses, GP, dentist with a special interest, and specialist.
Specialists. So you've really developed that now, haven't you, Alfonso?
Yeah, it's growing quite a lot. Yeah,
it's really good. And actually, I would imagine the companies that you're working with are very interested in helping.
I think we've been lucky, because I think like after that we started, a lot of people that were trying to do the education. I think we were one of the last one that have managed to get a bit of support. But at the moment, myself, I'm kind of opinion leader of like 14 different companies.
That's quite a lot.
Yeah. So every day there is something arriving. Could you try this? Could you try that? Yeah. So it's quite good. But and then it's nice because we've got like a relationship with most of them. Like with Straumann. Obviously, that. But I think I've got probably even better relationship with other companies like NSK. Ralph is such a nice person.
Yeah.
Or Geistlich, I get on really well with them.
Yeah.
We've got Acteon, Hostel, U3D, Chris, a lot.
So quite a lot of things. Yeah. That's a lot to be responsible for, Alfonso. But yeah. So I mean, today I'm talking to you about NSK, but
of course.
So presumably they tell me that you use the Surgic Pro in practice.
Correct.
So why the Surgic Pro in practice? And I mean, you can be quite honest about it. It might be because you were given it and that was that. But what was there a reason that you selected the Surgic Pro?
I mean, yeah, there was a reason because the truth is, as you said, is like I started with the Surgic Pro because that was in partnership with Straumann at the time. And then obviously from that I started my relationship with NSK. Obviously over the years I had, especially when I'm mentoring or I'm going elsewhere, I had the opportunity to try different motors, different system. And I really liked the Surgic Pro. The main reasons are is reliable. Like sometimes you get motors that the pump stopped working while you're doing treatment. I have to say we did in the academy about 8 Surgic Pro, and I don't think we really rarely have a problem with any of those. Which is not like you've got like a good batch. If 8 they are working, usually means that they're working. Is also sometimes for example, like without comparing with a different company, but I used to have an old W&H before, and you had quite a lot of limited setting that you could choose, rather than the Surgic Pro is almost like an open system that you can tweak based on the patients, the system that you're using, the quality of bone, so you can customize and bespoke for the surgical procedure that you're performing. These are 2 of the main reasons. The third one is the support of NSK. So where we know that, for me, having the support from the company is something extremely important, because if you've got any problem, NSK is always on the other side of the phone, helping, supporting, repairing, or help with the maintenance. So these are probably the 3 main reasons.
Okay, no, I mean, and it is what a lot of other people say, that I think the reliability of the product is amazing, and especially when you're doing surgical procedures, you want reliability, don't you? I mean, you can't have something that you're not confident of, and as you say, the support of NSK is fantastic.
Yeah.
In terms of the surgical handpieces that you're using, presumably you're using NSK surgical handpieces.
I use the dismountable handpiece. I think like we've got like the top of the range, the one that they've got.
Right, so you've probably got the dismantle. You can take it apart so that you can completely clean it, basically.
Yeah, I think that is one we've got correct.
Right, okay.
We've got the dismantleable one, and also like fiber optic, because I think there were some that they are with the LED light and other without.
Yeah.
The nice things of that one is that comparing, for example, with others, is from an ergonomic point of view, is really good in terms of it's easy to handle, it's light at the same time, and the fiber optic also can be really helpful in certain occasions.
To be able to see.
And I guess like from the cleaning side, my nurse is OCD, so Annali that is the only nurse that I work with. So she's in Mexico at the moment, so I'm not placing implant until she's back.
When's she coming back?
she's back. She's quarantining at the moment, so
okay.
Back next week. So next week we start again.
You start again placing implant.
Yeah.
And do you use the the variosurge, the ultrasonic?
I mean, for the Delta Academy, for example, like last year we did a course with the sinus lift course with Korai.
Oh, right, yeah.
And Korai, he likes the NSK. So Alex and provided just the kit on loan. So I've used the NSK kit, and sometimes on some courses we use that one if the speaker, so someone has got strong preference for that one. And I've got the time that I've used, it's really good. Again, is really powerful, precise.
How much general dentistry or do you do? Do you do any general dentistry at all?
No, basically I only do implant and Invisalign.
Right.
So my general dentistry is really limited. So really, I only use. I do a bit of general dentistry if it's related with the implant side. So, for example, if there are two central, I will restore the other central as well. So I also use only the Z Max.
The Z995.
Yeah, that is the one.
Speed increasing. The speed
Yes.
increasing. Yeah.
I only use that one.
Right. Okay.
So I don't use any turbine. I only use that one.
Okay.
And if I do any like full arch and I have to remove the composite, or we only use those.
Right. Okay. I mean, a lot of people are now moving much more towards speed increasing handpieces because you just get a lot more control, don't you, than you do with the turbine?
Yeah, that's the reason. Like I stopped even when I did probably 2 years ago was the last time when I was doing a bit more general dentistry. But even at the time, I was not using turbine anymore. I only use a speed increase.
Yeah, no. And actually, I don't know if you've read, I can send it to you actually. There's an article just come out of guys looking at aerosol generation around the difference between turbines and speed increasing. And obviously, if you run a speed increase, you can't run it at full speed, but if you've run it at to a decent speed still, it vastly reduces the aerosol generation, which is quite interesting.
And the other things is as you said, one is the control, but the other things that I don't really feel the need of go to any higher speed than what the speed increase can generate.
Yeah.
So and when it's getting too fast for me, like if for whatever reason it's in the autoclave and I have to use, I find that the turbine is too fast. I almost can't control.
No, yeah, it's either on or off, isn't it? You either and it's just as you say, there's not that level of control or torque that you get with a speed increase.
So I have to say, also in the practice, we've got few turbine because there are some dentists that they still like the turbine to have some turbine. But overall, as a practice, as a protocol, we've got all the speed increase with the micromotor.
With the micromotor, yeah, I think it's a much better protocol, and for the kind of dentistry that you're doing, is where it should be, isn't it? Really, yeah, definitely.
Ralph was going to send me some of their new one because they've got some new that they've got more with reduced aerosol.
Yeah, that's the one. So basically they've adapted the Z95 and it's got a little switch on it now.
Yeah.
So that you can actually you can keep the water jet going, but you can turn off the air.
Yeah.
So basically then that reduces the amount of aerosols coming, because you're not using the air to sort of force the situation. Yeah. And in terms of you've spoken a little bit about your relationship with Ralph, because Ralph is quite new to the NSK team, isn't he? He's only been there for, I think, a year or something like that. But you've obviously developed a good relationship with Ralph.
Yeah, and I mean, Ralph is really interesting because I think he's a German, and then he moved to Australia, and he's been in Australia for many years. And I think that he worked with a different company in the dental industry. And then I think he was with NSK in Germany in Australia for a while.
Yeah.
And then he moved. So I think overall he's been with NSK for like 12 years, 15, quite a long time, which is not usual for nowadays company to keep someone even in a different role, in a different position. I think he moved in UK not too long ago, but he's really passionate about education. So I think that Ralph probably spent more days in Delta than I do. So Ralph is always there, and he get on really well with Evelina, that is the manager of Delta basically. And he's one of the nicest person that you will find in dentistry. He's a really nice person, and like when people that they are in sales, they don't tend to sell. I find the best one that they're selling something. Yeah. So believe in the product. He's comfortable that what he's selling is a good product, and he's happy to help and support. and that usually is enough.
Yeah.
But it's never been pushy, and I think they'll do really good offer for our delegates. But in all fairness, it's a pleasure for us to recommend them because we know that the way that they work is good, and Ralph will be there to help. So if anyone had any problem, they've always. I have to say, Ralph is also living in Bath.
Yes.
So Ralph,
he's close to you, isn't he?
I see Ralph probably at least 2-3 times a month.
Yeah. I mean, Alex probably wants to keep in touch with you because of, the scale of what you're doing and the academy, and you're an important client to them. There's no doubt about it. But you're right, Ralph is like your day-to-day go-to person, isn't he? And he's obviously doing a really good job of it. To be honest with you.
And I think he also in Australia, I think one of his role, if I understood correctly, was about education. So when he had the opportunity to work with Delta with education, he was really, really happy because I think he strongly believes in the education.
Yeah.
So that's why I think that there has been that kind of good synergy rather than just, like a rep.
Yeah, I think he built up a different kind of relationship with his clients. To be fair, and he's a very, very, very nice guy, isn't he? He seems very, very able to, as you say, he's not trying to sell you anything. He knows the products are good, and he just wants to support what you're doing. I think that's it, really, Alfonso. I think you've been giving me a good flavour of what they do for you and how you work with them and the equipment that you use and things. So. I wish you all the best for 21, Alfonso.
Thank you very much. So for you too, and it's been really, really nice to see you again.
Thank you. Yes.
Hopefully, I'll see you soon again.
See you soon. Yeah.
Ciao. Thank you very much. Bye.
Bye. Many thanks to Alfonso for his insightful interview. If you would like more information about NSK products, simply visit mynsk.co.uk, where you'll find a range of product information, articles and podcasts.